Before I jump into this video, I would like to question you. Are you suffering from asthma or COPD, chronic obstructive pulmonary disease, or emphysema or bronchitis? Then this video is definitely for you. And if you are seeking for some help without any medical things, then you can definitely rope into or jump into the breathing exercises. Breathing exercises are some things which will not give you a quick result, but if you will practice these exercises for 3 to 6 months, you will definitely notice a change in your health issues, in conditions like asthma, etc. So, and the second part of this video is how can we manage asthma in emergency? If an attack comes and you don't have your inhaler, then definitely it can be managed. I will be discussing both of these things, breathing exercises for the asthma patients and different conditions, and the second, emergency management of the asthma. So let's start the video. Hi friends, this is your physiotherapist cum dietitian Dr. Pratibha. How are you doing, guys? Hope you all are good. This video is about breathing exercises for asthmatic patients, for bronchitis, for emphysema, and for COPD, chronic obstructive pulmonary disease. And the second part consists of the emergency management of asthma. If you don't have your inhalers with you, then what should be the emergency management of asthma? Both the parts I'll be discussing in detail. The first part I will be discussing first. First one is the breathing exercises for all of these conditions. I would like to tell you, breathing exercises not the thing which will give you instant result, but you have to definitely wait for 3 to 6 months and practice it regularly for twice a day if you want a consistent and a good result. This will definitely benefit you, I must tell you. Now let's start it. My very much first exercise is pursed lip breathing. In pursed lip breathing, you have to breathe through your nose, deep breathing. Now you have to inhale through your nose and exhale through your mouth as if you are whistling. You have to make O shape through your mouth like this. I would repeat again. You have to inhale through your nose and making the O shape of your mouth, you have to exhale through your mouth. Inhale through your nose and exhale through your mouth. This is my first exercise. You have to do this exercise for 10 times and twice a day, daily. Now, the second exercise is diaphragmatic breathing. For diaphragmatic breathing, you have to place your one hand on your diaphragm, that is on your abdomen, and you have to place your another hand on your chest or below your clavicle. And like this, you have to inhale through your nose and then again exhale through your mouth. Whenever you will be inhaling, you have to put little pressure through your one hand onto your abdomen, and the hand which is on your chest will be stable. You have to do this exercise for twice a day and 10 to 15 times at a time. Now the third exercise is Papworth breathing technique. Now what is Papworth breathing technique? Papworth breathing technique consists of doing exercises and inhaling through your nose only and then exhaling through your mouth using your abdominal muscles instead of using your chest. This exercise is very, very essential if you want to improve your asthmatic conditions. This exercise involves deep breathing. Now the next exercise is Buteyko's exercise. Now what is Buteyko? Buteyko's exercise is named after his inventor Buteyko. Buteyko's exercise consists of again breathing through your nose and then exhaling through your mouth. Whenever you will be exhaling through your mouth, you have to exhale twice the number of time as you are inhaling through your nose. Inhale through, if you are inhaling through your nose, count for 5, and then whenever you will be exhaling through your mouth, count for 10. That will be twice the time which you have taken to inhale. Twice the time the inhalation of air takes whenever you are inhaling, whenever you are inhaling the air through your nose, that time should be 5 seconds, and whenever you are exhaling through your mouth, that time should be of 10 seconds. That is twice the time of inhalation. That's it. And now the next exercise is nasal breathing. You can definitely do some deep breathing with your nose only. That's really essential because asthmatic conditions don't allow breathing through mouth. This definitely decreases the airway passage and thus limiting the oxygen intake also. I would like to go jump on my second part, that is emergency medical help whenever you are feeling an attack of asthma suddenly. If you don't have your inhalers, I would like to tell you, don't forget your inhalers in any case. Forget anything, forget just anything, but don't dare to even forget your inhalers if you are an asthmatic patient. But in case you forget to bring your inhalers with you, then definitely you can try these things if you have got yourself in the condition when you're having sudden asthmatic attack. Let's start it. The very first management is sit upright, because whenever you're having some kind of attack, asthmatic attacks, make yourself sitting upright, because bending down or leaning down can definitely constrict your airways and thus constricting or limiting the oxygen supply to your lungs. And the second management is take some caffeinated hot drink. Caffeinated hot drink like coffee, etc., can make your airways dilate and thus taking more oxygen. Now the third one is you can definitely try to take some spicy food that will also dilate your airways and maximize the oxygen supply to your lungs. Now the third thing is deeper breath. You have to take a deeper breath through your nose and exhale through your mouth for as long as possible. Now the next thing is go away from the trigger. If you have gotten attacked due to some smoke or some pollution or etc., go to the fresh air and feel yourself and make yourself calm. That's really essential. Now the last thing is, if you are not feeling well by these things also, by these measures also, then you can definitely call on to an emergency number and make yourself feel better. Go to the hospital and treat yourself. That's really essential. That's all for today. If you like my video, you can definitely subscribe it and like it. Thank you.